if your shoulder joint's hurting every time you reach overhead or you reach to the side, it's usually as a result of the shoulder joint not being supported properly. It's the structures that form the shoulder joint that are not moving properly, and as a result of compensation, you pull in your neck, your mid-back, your breathing is involved. All of these get pulled into the picture. This video is all about the causes of shoulder pain that happen when you reach over or when you do certain movements. Your shoulder joint is a ball and socket joint. The ball part is provided by the arm, and the socket part is provided by your shoulder blade. So when the ball and socket joint don't dance together, you can easily compress and irritate structures. So what ends up happening is most often the shoulder joint issues is as a result of the shoulder blade or your scapula not knowing what to do. The reason for that is because we sit for extended length of time. That's common cause, not necessarily the only reason. But we're sitting for extended length of time using our arms, and the shoulders roll forward, the shoulder blades roll forward. It impacts our whole posture, and that rolled forward shoulder blade will basically lead to certain shoulder blade stabilizer muscles that don't get to practice what they're created to do. That lack of practice leads to lack of performance and feeding of the problem. So when typically when you have pain in the front of your shoulders, that can be an arm thing, and it can also basically be that the ball is hitting the front of the socket and causing irritation. When you have pain at the top of the shoulder joint, that typically comes from a specific muscle of your rotator cuff that is called supraspinatus. It's the most commonly hurt and torn ligament that we have in the rotator cuff area. So essentially, then the question you want to ask is, what do I need to do to fix it? The fix comes not by you stretching or by you strengthening the area. Stretching means there is tension, so you want to ask, why is there tension? And strengthening means it's weak, so then why is it weak? You cannot strengthen something that does not have stability in place. If you do, you're simply going to hurt yourself and basically waste the time. Instead, what you want to do is you want to place the mechanics in place, proper mechanics, the proper movement patterns in place. What are those patterns? If we watch human babies and see how we develop until we're stable enough that we can become independent, we can walk, we can run, we can grab things, and we can function properly. When we study babies up to age 4 or 5, when we start going to school and start messing things up, we see that there are certain behaviors that are followed. Those same patterns of movement, those same stages of movement have to be in place before the next one is brought in. So certain movements have to be taking place. The body parts have to dance together properly, which at this juncture you don't know what they are. That's what this channel is all about. If you have not subscribed to the channel, make sure you do, because the whole intention is to educate you on not wasting time doing the wrong exercises or living your life in a fashion that simply feed the dysfunctional patterns of movement. So now I'm going to show you some of the exercises I share with my patients that are developmental exercise based. They're not the only exercises you do, but this just kind of gives you an idea of what they look like. Developmental exercises are low impact on the joints, and they're the same things you've already done. No one taught you and I how to move as babies, and yet every walking human being on the planet Earth has followed the same stages of movement. So we're hardwired to follow that way. Our body parts know exactly what their job is if they're provided the opportunity. The key here is for you to provide the right opportunity so your body parts can play correctly. So the 3 exercises I'm going to show you are going to be, but the first one is gonna, actually I think all of them are gonna require you being on the floor. If you turn that around so I can see, you're gonna lay down on your back and you're just gonna go with the letter W. When you're on your back, you wanna close the gap in the small of your back because that gives you a neutral spine. You want to breathe biologically. If you don't know how that's done, make sure you subscribe to my channel, but I'll make sure I'll put the biological breathing at the end of this video because biological breathing is what's required for your trunk to be stable. Your shoulder blade, remember I told you your shoulder blade typically plays a big role in shoulder joint dysfunction. Your shoulder blade is part of your trunk, and its positioning and activation of shoulder blade stabilizers is important. You want to provide an environment where your muscles of your trunk get to have a chance to perform properly. So biological breathing has to be in place. You place your hands on the floor, and if you have a tight pec, you're not going to be able to place the back of your forearm on the floor. So that's a dead giveaway. You do not have a balanced shoulder joint. So in this case, you can put something under your forearm for the time being, but don't get in the doorway and try to stretch your pecs. This is the proper way to stretch your pecs with the lower back spine closed. Your pelvis is tilted into a neutral position. You're breathing biologically, so all of your body parts are performing their job correctly. So your pectoralis muscles have a better chance and they have the reason to actually start stretching. So that's number 1. The second one I have listed here is late 3 months. Something you did when you were 3 months old. What you do is you go on your tummy and place your fingers and your hands under your shoulder joint, like so. So they're not in front of and they're not too far back. They're just under your shoulder joints. You go on your forehead. The top of your shoulders are away from your ears and you're pushing the ground away as if you're trying to slide yourself back. Make sure you do not use your upper trap. So remember, top of the shoulders away from the ears. You're pushing the ground away to slide down. That's as if you're doing it. So you go from the forehead, you scrape your nose, get the tip of the nose off, you look up for about an inch, hold your head in place. From between the shoulder blades up to the neck, glide the neck up, top of the shoulders away from the ears, and you push the ground away to get yourself up. Don't look down. Do you see how the top of my shoulders are away from my ears and I'm not bringing my shoulder blades together? That's the key. And you bring them down. When you do this, you're using your shoulder blade stabilizers properly and your arm connection to the shoulder blade or shoulder socket is nice and functional. Finally, this is something that I have used developmental exercises to kind of create this. I want to be able to rotate the ball and socket in an easier fashion. So you want to lay down on your back, bring your legs up, the small of the back is closed, like as if you're holding a giant teddy bear. Place your arm in a W, the one side, and you want to be able to tilt as your arm rotates. So it's this movement. when you're rehabbing your shoulder joints, especially if you're in pain, you want to make it low impact. You want to make sure that you provide an environment when you're not really loading the joint so much. This exercise that I showed you is an offshoot of a combination of a side-to-side move in the developmental exercises and another move, which is what we did at age 7 months. Once again, if you have not subscribed to the channel, make sure you do, because these are exercises I have on my YouTube channel, and it's all about proper form and mechanics. You cannot strengthen any joint if proper mechanics is not in place. You cannot build a structure over a swamp. The base of the joint needs to be intact and strong and stable before you have a chance. I hope this helped you. Make sure you subscribe. Make sure you comment below with any questions you have, or if you have any suggestions for any videos, use the opportunity below to comment and I'll respond accordingly. Thanks for watching.